someone dies of an overdose, no one brings a casserole. In some cultures, including my own family traditions, a casserole is a demonstration of charity, compassion, or comforting others in your time of need. Got a new neighbor? Tuna noodle casserole, unless they don't like fish. Had a new baby? Enchiladas. They freeze really well. Lost your job? My mom's homemade macaroni and cheese. Death of a loved one? Shepherd's pie or maybe lasagna. But here's the deal. If that loss is an overdose death, most families don't receive a knock at the door from their neighbor with a warm casserole. Instead, they get the questions, the whispers, and the stigma, which continues the cycle of deadly consequences. In our Midwestern United States community, we created an initiative called We Heart You to counteract this behavior. This motto is about breaking the silence, reducing stigma, and saving lives. It's about getting rid of the shame and stigma, those negative perceptions and stereotypes that you think that aren't based in evidence, and letting people know that this disease does not have to be a death sentence. Addiction is synonymous with guilt, shame, and stigma, and it impacts so many of us, whether you're the person struggling or the person trying to help. If you have an addiction or are using drugs, some people say, you chose this lifestyle. You have a moral failing, or you're just a deadbeat. If you're a family member or friend, some people say, maybe you did something to cause it, or maybe your loved one deserves it, or maybe they want to die. Imagine your loved one dies, and even in the legacy of their obituary, you can't share the guilt, the truth, the pain, the vulnerability, or the devastation. If you're an advocate or service provider, some people say, you're enabling people to use drugs because of the tools or help you might provide them to keep them alive. This kind of stigma is certainly not limited to overdoses. You know what else used to be talked about in whispers? Cancer. Also, a chronic, treatable medical condition. That's right, substance use disorder is a chronic, treatable medical condition. A little louder for the back. Substance use disorder is a chronic, treatable medical condition. So back to the cancer. In the 1950s and 1960s, for those younger generations, you may not know this, but science was moving forward in treatment options. Yet in our communities, people with the deadly diagnosis were greeted with hushed tones and questions of, well, what caused it? Was it because you smoked too much or you ate the wrong things? The blame and shame game made the diagnosis even worse because we didn't have the preventative or treatment options that we have today. Thanks to federal research, treatment was dreamed of. Cancer was dreamed of as being treatable and someday beatable. Love you, Dad. Which is the exact trajectory we want for this overdose and substance use epidemic. No more hushed tones and whispers, but cheerleaders pushing us to talk about what we can do about it. I live in Winnebago County, Wisconsin, woo-hoo, which has a population of roughly 171,000 people. So no, it is not a major metro area. But what we're doing is innovative, and it's putting us on the map in a totally different way. For the last 6.5 years, I've had the incredible opportunity of leading the Winnebago County Overdose Fatality Review Team, or OFR, as we like to call it. Every month, a group of community partners comes together to review someone's overdose, fatal overdose, and the life they led up to it. Our purpose is to create change, to prevent future overdose deaths from happening. You may be thinking this committee is 10 of the usual suspects in your community, right? You'd be completely wrong. How about 20? Yeah, no, still nowhere near. How about 30? No, even higher, right? 49 partners representing 35 agencies all come together committed to this work. People of different backgrounds and perspectives, people of top organizational leaders and everything in between. We represent law enforcement, public health, treatment and recovery services, healthcare, city and county services, faith, education, and people with lived experience, people who've been through it. Together, we're able to learn from someone's life and death to do better for others. We're able to provide a legacy for someone who may not have had one otherwise. Almost every community in every state is dealing with this problem. Whether it's an opioid epidemic or the latest and greatest drug to make people feel that their problems have been solved. It's hard to estimate the number of people who've died from fatal overdoses around the world, but we know in 2022, an estimated 292 million people used an illicit drug. Leading the world in overdose deaths, not something you want to be the leader of. The United States lost 101,168 people from fatal overdoses between April 2023 and April 2024. I'm going to repeat that number. The US in 1 year, and this number went down, lost 101,168 of our family, our friends, our neighbors. That overwhelming number doesn't include everyone who had non-fatal overdoses and may have been revived by naloxone, also commonly known as Narcan, a life-saving medication that can quickly reverse an opioid overdose. We all are surrounded by people fighting for our lives. The idea of We Heart You was created, inspired during one of our OFR case reviews. A police officer, who's now a chief of police, shared his frustrations of another sad story of someone who had lost their life far too soon. He said, what if we were to create a card that said something like, "We care about you"? And on the back, there was a resource number that you could call. And he pointed to his uniform, and he said, even though I wear this, and I have to do my job, what if I could tell people, I care about you, and I want you to get better? The conversation continued, and he worked away at his laptop, when all of a sudden, he showed us this logo. And it said, "We Heart You." And everyone in that room got it. And I got the same chills at that meeting as I do today, and every time I share it. Maybe the person doesn't listen the first time to that officer, nor the second or third time to the paramedic who's reviving them. Probably not the fourth time from their case manager, their fifth time from their healthcare provider, but perhaps it's the 10th time when they hear it from family or they hear it from a peer, when they finally say, "Oh, okay, I hear you. I'm ready to get help." We Heart You is authentic, and it is a seed to be planted, even if the person isn't ready to listen. I am an ally to the recovery community, and I don't take that role lightly. When I first heard about this work of death and drugs, I thought it sounded incredibly morbid. But then I got this knot in my stomach, that knot that tells you have to do something. I had done community building work before, but at that point, my daughter was 18 months old. Isn't she cute? And I looked at her, and I thought, what if this becomes my story? What if she experiences trauma or systems aren't in place or people aren't there to support her as she grows? What if she has a friend or a friend's parents struggle with substance use? What can I do? But then I knew. Our work is like a dartboard, but we aren't solely focused on the bullseye. Instead, much like treatment and recovery having many pathways, so must our work. My job is to work with an incredible group of community partners to throw a dart every single day and try and fill that board. And when we can do that, then we are having an impact. Then we are saving lives. Although I don't personally have lived experience with substance use disorder, I have worked alongside many courageous people who have. People who are one drink or drug away from their own addiction. But that's not my story to tell. Mine is the way of how communities can break stigma, inspire help, inspire change, remind people that life can get better. It's also about reminding first responders, treatment and healthcare providers in your communities and in mine not to give up. No matter how exhausting it is to respond to the same person, the same house, the same problem, even after you've had the conversation or given the card, do not give up. Please, do not give up. Use the tools and the We Heart You movement that has already grown exponentially from our small community to around the nation. Recognize the human who is shackled by this disease. Continue to give them a way out. We need to encourage people to feel hope because without it, why would they keep trying to move forward? So many already think that recovery is unattainable, that treatment isn't available, or that they're not worthy of love and support because of the shame of their addiction. Not all of this work is measurable. But in the last 6.5 years, I have seen so many community partners transform. They may start on this team by joking around and using hurtful language to those struggling because in a way, they need to numb themselves much like someone who's using drugs. These providers see the ugly side of addiction over and over and over again. But then a year later, when they've done this work and they've gotten to hear the full stories, the true stories, all the different traumas, all the different interventions, all the different opportunities, those community partners say, oh, wow, they're human. They're fighting a disease. Maybe I could do something different. Maybe I could lift them up during their window of opportunity and connect them to resources. That's when I know we have made a profound impact and will continue to do so. We've created our own kind of casserole with a recipe to save lives. Although it's hard to estimate the number of lives that we've saved because this work is prevention, through our We Heart You work, we have empowered a recovery community to do what they do best and work alongside a jail to reach those most isolated and vulnerable. We've gotten people connected to the health department to get free naloxone, no prescription needed, and this medicine can keep people alive until they are ready to get help. We've handled children with care, closing the gap between police and schools so that kids who experience trauma can get the resources that they need and get help when they need it. And we've encouraged families to talk about addiction and substance use with people that they know, even in obituaries. This can inspire others and interrupt the status quo of addiction, so we have more opportunities for love, fulfillment, and reuniting families. We've changed many minds, many systems, many perspectives, including how I, as a parent, continue to learn and talk to my own kids about drugs. We Heart You is more than a saying. It's a t-shirt. It's a resource card. It's an app. It's a website. It's a public service announcement. It's an award. It's an event. And it is a movement. It's about breaking the cycle so that the next generation doesn't think of this as the norm, but continues to seek help as they need it. Over the last 6.5 years, I have reviewed many cases of people who have lost their life far too soon. Sad stories. Stories of missed opportunities where people didn't get to treatment, didn't connect with a peer, didn't get to go see a doctor. Stories where people were completely alone and having no one to turn to. And stories that didn't have to finish with a sad ending. If you're listening to this and asking yourself, well, what can I do about it? This is what I've learned that I hope you take with you. 5 things. Number 1, no matter the role you play in helping, do not give up. 2, carry the life-saving medication naloxone. Check your local pharmacy or public health department. 3, pivot with hope to inspire others. 4, share empathy rather than pity. And 5, remind one another that while you cannot control the addiction, you did not cause the addiction, and you cannot cure the addiction. You can connect, love, support, and empower. Every person on this planet deserves to hear, you matter. You are worth it. And even when you feel like you can't go on, we heart you.